We're here to talk about the vaccine mandate and what the impact means here in Los Angeles County. And this is, there's when you make policy decisions and when you do a policy analysis, probably some of the first steps you need to do is actually see what is the impact of a proposed policy prior to putting the policy in play. And what we've had happened with the Board of Supervisors in their August motion is they put the policy in play first, and then now they're trying to scramble to figure out what the impact is going to be. And people are saying, well, I've been talking about hypotheticals. No, we actually have some hard data that we have to live with, and this is the consequences of bad policy making. As you can see right here, the retirements, that number 19.8 are rounded off to 20%. That's 102 people that are already filed for early retirement. And the people that are filing for early retirement, these are people that have the institutional knowledge. They're the experts in so many different capacities: homicide investigators, crisis negotiators, senior patrolmen. I mean, all kinds of different positions these people occupy, investigators. And these are the people that are starting to walk away. That number is significant. And, okay, people with 28 years of plus of service, that's 1,605 sworn right there. And that is literally probably half of, I'm just picking on one bureau alone, that's probably half of our homicide bureau right there. Those are the people that can retire, and they're not going to lose any money behind retiring because they've already maxed out their retirement benefits, and they can simply just walk away because they're just fed up with the nonsense going on in county government. Hit it. Now these people, 238, that's the number of people who have filed for leaving the department in different ways, transferring to other agencies outside of LA County, outside of the state of LA. Some people switching careers. These are numbers that people already submitted paperwork. Okay. Workers' compensation claims. The saying is that people vote with their feet. Now we've also seen a 21.9, 22% rise in workers' comp claims. That's 315 more people than the same time last year. And again, this is all related to the COVID response or the vaccine mandate. Now let's slow down a second here, because remember that 22%. Also remember the 20% from the early retirements. Those two numbers alone, that's 417 individuals. Add the 238. Now we're up to 655 people that are already putting in motion plans to leave the department, or they're already gone from the department. That's significant. Okay, let's go. Now, registered. Fulgent is a system that the county is using to register and track who's complied with the vaccine mandate or not. And you can see the number totally registered, 79.5, and you can see between sworn and professional staff what the numbers are roughly. So we got 75.2% for sworn, 87% for the professional staff, so a total of 79.5. Now let's go on to what it boils down to, actually the vaccine mandate itself. People are vaccinated. For the whole department, we're sitting at 51.7 as of this morning. And you see there's quite a difference between our professional staff at 67.2 and our sworn staff at 42.8. That's quite a difference between the two. A lot of this is driven by people just don't have faith in the vaccine. Some of it is driven by a political ideology. Some of it might be irrational. Some of it, people have a legitimate reasons why they don't trust the vaccine. And in a department, in this profession, which tends to be dominated by people that have more conservative leaning, this is what you expect. In very similar numbers you're seeing in our fire departments throughout the nation, and also in police departments as well. Okay, go on to the next. So subject determination, these are people who are not vaccinated, are registered in the Fulgent system. That's the grand number right there, 4,185. If you look at the sworn number, 3,137, that is the size of almost our entire patrol operation right there. Similar, it's almost the size of our entire custody division operation. So imagine what would happen if every one of these was forced or was terminated. What would the department look like? All right, go on. So we compared with other counties, what's going on with other counties that surround us. Turns out every single one has a no. Orange County, we put an asterisk because their patrol is no vaccine mandate. Their custody operation, which has a medical component, it has a vaccine mandate. Our department, we have a vaccine mandate for those who work in our custody, our correctional treatment center. In a medical setting, they comply with the state requirements for vaccines, and we're able to accommodate that. Okay, but you can tell the surrounding counties, it's a big no. And most significant, about half, at least half of all of our sworn personnel don't live in LA County. They live in the surrounding counties because they cannot afford to live in LA County. So Riverside County, San Bernardino County, Ventura, all of those, in Orange County as well, all of our residents or our sworn personnel live in these counties. So you can see it's very easy for a deputy who lives in another county to say, you know what, they're hiring, they don't have a vaccine mandate, and they can just jump ship that quickly. All right. Now, let's go on to the next one. Now, a lot of confusion was generated by the board because initially, if you recall, this is the recommendation, board motion number 21. They want to do a vaccine policy, including a requirement for counties to be fully vaccinated, or they must undergo weekly testing. That was back on August 10th. And that was the initial board motion. However, look at the revision that happened afterward. As submitted by Supervisor Solis, now all of a sudden the testing disappeared and all employees required to provide full proof of vaccination. So between that date and today, you're seeing all kinds of iteration and deadlines and, well, how are we going to do this? And because they're asking the questions first, they put the cart in front of the horse. And it's comical, but sadly, it's actually disrupting our ability to provide public safety services to Los Angeles County, as you can see by the numbers that we're showing you. And hold on one second. With that being said, this needs to be aired out publicly. And we need to hear this debate. And what we're getting is this Zoom thing, just like right now, as we speak, there's another Zoom meeting of the board. But go on to the next. SoFi Stadium. Next one. Dodger Stadium. Last but not least, Staples Center. All of these places, people are congregating shoulder to shoulder, screaming at the top of their lungs without masks. And yet, last but not least, this board today is declaring that they cannot safely proceed with a board hearing. That is utter nonsense. It's a violation of the Brown Act. Everything they're doing is a violation of the Brown Act because they're deliberately excluding the public from participating fully in airing all of the motions and all the decisions that the board is making, which are being made behind closed doors, behind plexiglass, and you don't really need to know why. And this is what's going on right now. So you explain why that's okay, but they're saying that they can't safely do a meeting in public at the Hall Administration. In fact, I have one supervisor who has never attended a board meeting in public, Supervisor Holly Mitchell. If you notice here, it's Mark Ridley Thomas on the screen. So something's going on, something's rotten, and we need to fix it. But as it impacts decision making and the vaccine mandate, we have a lot of ground to cover, and we need to have our board have realistic policies that are based on facts, based on science. If you look at the entire county and what is achieved by trying to impose a mandate that you physically can't impose without losing a huge segment of your employee, your workforce, in comparison to the entire population of the county, the facts don't support it. They just don't.